Thank you and good morning, dear colleagues, dear committee. My name is Lőrinc Frivaldszky. I'm a resident at Better Children's Hospital, and with our team we are working on improving the quality of life for women before and after childbirth. We have two projects ongoing right now. The first has started in September last year, and the second started this March. With our first project that is investigating the efficacy and safety of esketamine on postpartum depression in women undergoing cesarean section. With this project, we have already multiple submissions. The last one is from end of May. This disease, PPD, is quite prevalent, affects 14% of all women after giving birth, and it is a debilitating but treatable disorder. It has a quite diverse set of symptoms that include sadness, sleep disturbances, and suicidal behavior as well. And women undergoing C-section are quite at risk for this disease. At this stage, there are no preventive treatments known. But we have a promising possibility, esketamine, that is used in clinical depression. And our aim is to assess the efficacy and safety of this drug for PPD prevention. We have a question. So does esketamine reduce the risk of postpartum depression in this population, that is women undergoing cesarean section? We administer esketamine perioperatively, and we compare the effect of this drug to placebo or standard of care, and we are assessing the efficacy. I left us a few words here, so we are assessing the efficacy of this drug with the reduction of number of PPD patients after administration, and we are assessing the safety with adverse effects as well. We conducted a systematic search, and we ended up with 8 eligible full texts after the selection process. I'm going to present a few plots on the next slides. We have so these plots contain only 8 eligible full texts, but in the literature there are some more RCTs that appeared after our first selection and first search. We rerun the search and we redid the data extraction, and I really hoped I could present these new results, these new plots, but they are not ready yet, so I'm going to stick to the old original ones. So our first plot contains our primary outcome, that is the odds ratios for postpartum depression measured on 3 to 7 postpartum days. So as you can see, we have 5 studies. On the left side, you can see the esketamine and the control groups, the number of events in both groups, and you can see the odds ratios on the right side. As you can see, we have low heterogeneity. It's 15% the I-square value. And if you look at the odds ratio value, the pooled odds ratio, it's 0.32. It means that the women receiving esketamine have almost 70% reduction in the odds for PPD after the administration of this drug. So from a clinical point of view, this is very relevant and mathematically also significant. On the next plot, you can see one of our secondary outcomes. This is the Edinburgh Postoperative Depression Scale, or EPDS scores, measured on the same time points as our previous plot. This scale is for measuring the severity of PPD symptoms. It ranges between 0 and 30. 0 means no PPD symptoms, and 30 means the most severe symptoms you can imagine. As you can see in this plot, we have a quite high heterogeneity, and if you look at the mean difference, the pooled mean difference, it is minus 1.42. It means that we were able to reduce the EPDS scores after giving esketamine. This is clinically less important compared to our primary outcome, but is still a significant reduction. We, of course, assessed the safety of this drug as well. So we analyzed 5 important postoperative adverse effects. and we pooled the odds ratios and put together the pooled odds ratios on this plot. As you can see, there are, for example, dizziness, that there is an increase in the group receiving esketamine, but none of these adverse effects appeared at a significantly higher rate in the intervention group, so we can assess this drug as a safe intervention. So our strengths are that we all used RCTs with low risk of bias, but the low number of cases and the different definitions for PPD are limitations for our study. So we can conclude that esketamine perioperatively can effectively and safely prevent PPD in this population. So we can recommend for practitioners to use this drug for PPD prevention. And of course, we need more research, we need more RCTs with longer follow-up times, different dosages, and diverse populations. So our manuscript is currently under review. Yesterday we got a request for a minor revision from this journal, so we are really hoping that we are on the brink of acceptance here. And I would like to talk a bit about my second project as well. It's investigating the efficacy and safety of different interventions for nausea and vomiting in pregnancy. So this disease affects most of women during pregnancy. In most cases, it is quite mild, but it still can be a burden for expectant mothers. And in some severe cases, it can even lead to malnutrition, depression, and other serious outcomes. There is a wide range of interventions for this disease, but the data supporting the efficacy of these interventions are quite unsatisfactory. So we aim to assess the safety and efficacy of different interventions against NVP. So we are asking a question, so which interventions are safe and effective against this disease? We are looking at women with this condition. We are looking at different interventions compared to placebo. We are looking at efficacy outcomes, the number of vomiting episodes, the puke score, that is a life quality assessment score for NVP symptoms. And we are looking at the safety outcomes as well to assess adverse effects as well. So thus we can provide a safe and effective intervention, or at least say which are the most safe and effective against this disease. So we are currently doing our systematic search process. The selection process. We ended up almost 10,000 hits after the systematic search. We finished the title abstract selection recently, and we have started the full text selection as well. And we are hoping to proceed with this research too. So to conclude our progress, the first one about esketamine for PPD prevention, it's quite in a well progressed stage. We are currently waiting for answering for the minor revision request, and with the second one we are at the full text selection stage. Thank you for your attention, and I would like to hear your questions and a quote from my side. A cheerful heart is good medicine, but a crushed spirit dries up the bones. Thank you again.
Hello, my congratulations with your progress. I'm just wondering, what is the reason why you choose the population with cesarean section for your first project? Like the risk or the level of the depression of such women are higher comparative to who had delivery without operation?
Yes, it was a good guess. So they have a higher risk for postpartum depression. These women undergoing cesarean section. It's a multifactorial story. The experience and the interventions happening during C-section can have an effect for a higher risk for PPD. Okay. That's why we use this population.
So you're not interested in other women?
Well, in this study, we focused on this population, but it will be very interesting to look at how we can prevent this disease in other populations. And if we have the capacity in the future, we will surely look into this more diverse population.
Thank you very much.
Sorry for interrupting before the next question, but Lőrinc is a pediatrician and I have to answer it, I think, as a gynecologist. So usually at normal deliveries, we never give esketamine, so there is no data on normal deliveries. This is a part of taking care of the patients during the C-section when we give esketamine for other reasons, and then we can take a look at the results regarding depression. So at a normal delivery, you never give esketamine.
Yes, thank you. So this is the other side, the interventional side. Yeah.
I think I have. Hi, I'm Veronica from the gastroenterology group, and I think I have a half answer for my question. How does it administer? What does perioperatively administered mean?
Thank you for the question. So the studies used two main ways for administering this drug. So the one was a single infusion during the operation. So it means that after they climb the umbilical cord, they administer an infusion to the woman. The other method for administration is the PCIA, the patient-controlled analgesia method, where they give a longer infusion after the surgery. In most time, it's 48 hours, and the patient can control the speed and the dosage. Thank you.